So our next panelist is Lewin. He's with Sanofi Pasteur and is the Associate Vice President of R&D Strategy. He's been in the vaccine industry for over 20 years and has worked with a number of vaccine companies. And I believe during the pandemic he was with Novartis or Chiron, so he can hopefully, as a Vice President of and Head of Medical Affairs and Immunisation Policy. So Clem, can you give us your industry perspective, please?
Thank you, Jackie, and thank you to the organizers for giving me the opportunity to speak. And also, thanks to Dr. Midthun, I've now realized that there's a silver lining for having been at Chiron in 2003, 2004. I can claim responsibility for the fact that we now have multiple flu vaccine manufacturers. I'll feel so much better tonight. You know, this has really made it worthwhile coming down here. I'm privileged now to work for Sanofi, which is one of the largest, or the world's largest manufacturer of influenza vaccines. We actually have egg-based and recombinant manufacturing technologies, and have a history of investing in improving influenza vaccines and continuing to do so. And as a leader in this field, we work closely with WHO and other health authorities and try and address public health missions, including pandemic influenza activities. One of the questions I was asked to discuss was how we view a pandemic. Do we view it as business as usual? And I can say, I think unequivocally, that Sanofi Pasteur and the other vaccine manufacturers are committed to working on pandemic preparedness and responding to the threat, and we don't view it as business as usual. We don't view it as a business opportunity, but rather as a public health challenge that we have to help meet. As you've already heard from two of the panelists in some of the earlier discussions, we work closely with public health authorities on vaccine development, licensing, and distribution. One thing that may not always be evident is we work hard to prepare proactively to be able to produce as much vaccine as possible in the event of a pandemic, just like some of these exercises that you've heard about, figuring out what to do. We also do that. Try and figure out where the bottlenecks might be and work on them. In the event of a pandemic, we would do what we did in 2009. We would work all out in collaboration with our public and private sector partners to make vaccine available. To get that vaccine out in 6 months was a tremendous effort. Another question was asked to discuss was, what about distribution? And for the vaccine manufacturers, it isn't business as usual at all in terms of distribution. As if you look at the precedent of 2009, public health authorities would prioritize populations and determine the distribution of vaccines. In the U.S., for example, it was the CDC and public health authorities that decided where the vaccine would go. The companies manufactured it. Industry is partnering with national and supranational authorities on pandemic preparedness and response. The PIP framework adopted in 2011 that some speakers have already discussed is something we believe strengthens our pandemic response. Now, our role in the event of a pandemic is to make as much vaccine available as quickly as possible. You heard about from Rick, Dr. Bright, about the need to get ahead of the curve. You heard about the challenges. We understand that, and we want to work as quickly to improve our processes. We collaborate closely with BARDA and other organizations on pandemic preparedness efforts, and I think we're in a better place than we've been in the past 15 years. Dr. Midthun discussed some of them, but we now maintain a year-round supply of eggs, so if for the egg-based vaccine we can start. We have experience in producing pandemic lots of vaccines that can be tested with and without adjuvant, so we'll have hopefully some clinical data. H7N9 and H5N1 are example, and ensuring that there is pandemic production capacity available. A key lesson learned from the 2009 pandemic was how imperative it was to have the strong collaborations, including with the governments, proactive investment from both vaccine manufacturers were needed along with governments, And the existing and ongoing relationships that have been mentioned by the two previous speakers enabled us to do what would be a prompt response. And I think we are better prepared than we were in 2009. As Dr. Methuen mentioned, we have increased capacity, we have new technologies, but we shouldn't rest on our laurels, but remain vigilant, continuing to invest in pandemic preparedness and in developing the new technologies that are needed to move the curve. Now, we believe that the best way to ensure that the long-term capacity is available is to create demand and uptake for seasonal vaccine. Demand will stimulate increasing investment in seasonal capacity that can help us with the pandemic, and will also drive the investment in the new technologies and improved vaccines that we all want to see. And I think Dr. Mithun almost stole my thunder, because most of the capacity is, you've heard about the new capacity. So I think what we need to do from an industry perspective is build the delivery mechanism. So increased coverage of seasonal vaccine will help us with pandemic delivery. We should avoid cost-prohibitive pandemic-only facilities. Creating production facilities that are dedicated to pandemic vaccine and a pandemic that could occur maybe once every 20, 25 years isn't a realistic proposition. They either have to be used for production of other vaccines, and today we don't have those platform technology. So this is a challenge. So the best way is to build seasonal flu capacity. Another thing not to forget is a fill-finish plan, because you need an integrated fill-finish plan. We, for example, would need to go outside to fill the product. We can make the bulk, but for pandemic, Dr. Bright talked about 600 million doses, 700 million doses. Flu filling capacity is about 150 million doses in the U.S. for the manufacturers. So we need that. And then, as we've heard, is optimize the regulatory pathways to ensure that we can license the vaccine as quickly as possible. So I think a lot of the things that you've heard people touched on, and others, I guess the rest of the panel will touch on, are the same points that I'd like to make. But if there's one message I'd like to leave you with, is that for industry, a pandemic is not business as usual, and we are all committed to contributing to the response and preventing the consequences of the disease. Thank you.